This next exercise is called Iliopsoas retraining. If you don't know what Iliopsoas is, that is your hip flexor that attaches from the front part of your spine and comes down and attach here. What is that, your tenderloin? Your tenderloin? No?
Nope. Filet mignon.
Your filet mignon. So that's your iliopsoas. So what happens over time, if we're sitting a lot, you know, we're at our computer, we're watching a movie, these hip flexors get really tight. Your hamstrings get really tight. And so when you walk, you're constantly in a bent position. Like, this is a little exaggerated, but this is how it is. And so it turns off, like your hamstring does all the work when you're walking, it turns off your glutes, and then you go and you do that extension, rotation in that spine. So by correcting, you know, glute max activation and then retraining that iliopsoas in a good position, that, you know, you're just not always here and always overworked in poor position, you're going to retrain it in a good position to try to open things up. So you're going to lay on your back, and then you do that posterior pelvic tilt, and you bring your leg straight out, and then you rotate it slightly out, keeping my back flat. And I should feel it popping up right here. And I have my hands right on my hips and kind of a little bit lower, and that muscle just pops right into my hand. And you'll tell that this is a lot difficult than just holding that leg up. So if it's easy and you're like, I don't feel anything, you got to find that sweet spot, and it might just be a slight rotation. You have to feel it, and it'll pop right in your hands, and then you hold it for 10 seconds and do it 5 times. And you can alternate, and when you alternate, you don't want those hips to move, so you want to keep everything stable. Draw that belly button toward your spine, and then raise it up. See, I feel it right there. 10 seconds, 5 times, alternate.